How long is heroin detox? Part 2. How long is heroin detox? How to treat a heroin overdose. Overdose, or acute intoxication, is the ingestion, accidental or not, of a psychotropic substance capable of causing unconsciousness and being potentially fatal. We are talking more about overdose in French or acute poisoning. Generally, it occurs in the context of drug use, such as heroin, opium, morphine, but also cocaine, ecstasy, or MDMA. It can also be related to a suicide attempt, particularly with certain morphine-based or anxiolytic medications such as benzodiazepines, for example. It appears when the user takes a dose that exceeds his tolerance threshold, depending on his addiction to the drug, but also on his general state of health. In most cases, overdose leads to progressive loss of consciousness and cardiac arrest. Symptoms. Overdose manifests itself in different ways depending on the molecule involved in acute poisoning. It always begins with disorders of consciousness that can lead to loss of consciousness and a coma that can become toneless or on the contrary agitated. The person with overdose may begin to vomit, sweat intensely, breathe more slowly until they stop breathing completely. Depending on the drug used, the pupils may be highly constricted in miosis, or conversely dilated in mydriasis. The heart gradually slows down or races very suddenly until it stops. If nothing is done quickly, death occurs without effective resuscitation procedures. The number of drug overdose deaths has increased in recent years, especially with opioids such as heroin, morphine, methadone, buprenorphine, and codeine. Other drugs, due to their sedative effect, can induce an overdose, such as ecstasy, cocaine, and MDMA, which can cause life-threatening heart rhythm disturbances. In a person who has never taken opioids, the usual dose that can trigger an overdose is more than 1 mg per kilogram of body weight, for example more than 60 mg for a 60 kg person who never takes morphine. Diagnosis. Symptoms are usually suggestive when examining all of these signs, and even in the absence of a witness, certain substances may be involved depending on the symptoms. It is best to have a contact who knows the victim so that we can find out what substances she usually uses. Emergency hospitalization is systematic. How to treat a heroin overdose. In the presence of a person showing signs of an overdose, emergency services should be urgently called, and in the meantime the subject should be placed in a safe lateral position. Emergency hospitalization is systematic in case of overdose after medical transport. Treatment is adapted according to the drug used. Certain molecules are known as drug-specific antidotes and can be used to counteract the effects of drugs. A detox protocol is then considered for the addict to become totally abstinent. Flumazenil used as an antagonist and competitive with benzodiazepines in overdose, as well as naloxone for opioids. However, there is no specific antidote for cocaine, MDMA, and ecstasy, for example. Subscribe our channel for future videos, visit our website holisticmeaning.com for more informative articles.